Hi, everyone.
Hello.
Laughing at me because I am on the nose. It is 9 o'clock. We are getting started. So, hi, this is Melissa, and welcome to the June SASH coordinator call. We've got a bunch of people in the room here with me. We've got Molly and Madeline and Kirsten and Nancy and Lisa, and then a bunch of other people on the phone. So thank you all for joining us. And I will go ahead and kick things off with, I think, Molly, you're first on the agenda.
Really?
Yes.
Fantastic.
So we've got funding update.
Awesome. Okay. I would say poll question.
I think we're supposed to start with a poll question.
Okay, because I think I have a slide about the funding.
You do?
Right.
Okay. So.
Get ready, everybody. If you're not awake yet, wake up.
Yeah.
Why is this session being recorded?
And ready? Okay, so we're going to start off with a poll question. It's really, really important. What is your favorite summer activity? And I put hiking, biking, swimming, fishing or boating, or hammock and a good book. If you don't like any of those, then I guess I did not put in other categories, so you're just going to have to pick one. What do you want me to pick? Hammock and a good book. Hammock and a good book.
I love hammock and a good book.
Okay. Oh, people are voting. This is fun. This is my first ever poll. Good job, guys. Okay, so I'm going to close the poll in 5 seconds. 4, 3, 2,
Talks fast.
1.
It does everything fast.
I think it's an upstate New York sort of thing. Okay, so then I can share. Look at I did it. So 33% like hiking.
Yeah. Oh my
and
God.
then 16 down the board. That is hilarious.
That's, it's a good thing that we all live in Vermont when we like hiking. Right? I mean, this is awesome.
Well, so Molly and I shared our results in pictorial form. If I can just figure out how to get back to my audience view. Hold on. I knew it went too smoothly. Kirsten, why can't I share my...
Kirsten.
Oh, you know what? I think I have to close the poll, hide the poll.
There you go.
Oh, there we go. So Molly is with the core group liking the hiking there.
Yeah, that's on the top of Camel's Hump. That was a couple of years ago, although we do that as a family, usually every year. So I have 2 daughters. That's my oldest one, Ginny, with the braids, and my youngest one, Ellie, who's just about to graduate from high school on Saturday. And then, my husband. That's Francis. So he's pretty good, too. So anyway, yeah, we love to hike.
And I went with fishing and boating because if you are not finding my family on a boat in the summer, then you're not finding us. And there we all are with various fish. I do have to say my daughter Jessica has caught bigger fish than that, but that was the best picture I could find. And Nathan never fishes without that stupid hat. So, and my dog loves to swim, but he's a little roly-poly, so he needs a life vest.
I love he has a life vest. Who's the other dog behind your
that
husband?
is my brother-in-law's dog, and my brother-in-law is behind him. So it's always a big family event. We pack as many people on a boat as they can hold and go fishing.
That's great. And Jessica looks exactly like you.
Yeah, that poor little thing. She is my spitting image for sure. Okay, so moving us along here. Yay, look at this. I'm doing it. Okay,
Excellent.
You're up.
All right. Okay, well, anyway, I hope that those photos inspire you about the summer and all the fun activities. And like today's such a perfect day, and hopefully we'll have a lot more of those to do that because as you guys know, summer is fleeting in Vermont. Okay, so I wanted to start off with a funding update. So very good news is that the governor did sign the 2020 state budget, and in the 2020 state budget included fully restored funding for the SASH administrative work that is funded by the State Department of Disabilities, Aging, and Independent Living, also known as DAIL. So as you guys know, we went through another year of having to, remind the governor and the legislators of the value of SASH, and I can tell you that that part was no work at all. Whenever I went in to testify about SASH, I was stopped and, told how much, from many legislators, how much they value their SASH coordinator and wellness nurse out in the field, how many of their constituents rely upon you all. it happened in every committee I went to. So that was great. This was really about, a budget and scarcity of resources and no scarcity of needs throughout the system. And so it really was absolutely no indication of the value of SASH. It's just, there's also really important programs that need funding for disabilities and mental health and child care, you name it. So we just, like everybody else, we have to stay innovative, stay in people's face about the value that we provide. And that's a lot of the work that I do and that my team here does is make sure that the value that you guys are spreading out there in your communities is not a secret. So the funding was fully restored. The way it was funded was we were basically guaranteed for the next 3 years, fiscal year 20, fiscal year 21, and fiscal year 22, guaranteed our administrative funding through Dale with a federal match, and that's how it's always been. And then what the legislature, with support of the governor's office, has asked is that we work during these 3 years to transition to having One Care Vermont, which is our funder for all of your panels across the state, to have One Care Vermont also fund the administration of SASH. So it's all under one entity. And we were okay with that, except we did ask, and they agreed that the state of Vermont would have some portion of our administrative funding going forward because of the fact that the state comes to us regularly to spearhead work with our participants around priorities that are important to the state. An example of that is our work around opioids, our work around diabetes. All those are things that are very important to our population and also a priority for the state. So we want to make sure the state of Vermont still has some skin in the game if they're going to be, asking us to partner with them on certain policy efforts. So we're feeling really good about that. We work very closely with One Care Vermont now because that's where all of your funding on the ground is coming from. So we meet with them on a monthly basis. We think 3 years to kind of figure out how they will fund our administrative structure is a really good, solid amount of time, and it gives us a lot of stability that we haven't had in the past. I mean, every year we've had to fight at the legislature for this administrative funding. So to me, it's a really good thing. So the governor signed the budget, and we're good to go. There was no increase in that funding, though. I do need to say that, and we haven't had an increase in that funding since its inception. So we started getting this funding when we went statewide in 2011. So we have never seen an increase since then, even though we've grown from one panel to 63. So that's unfortunate, but that's life. So the other thing I just want to let you know about funding is that we also, as I said, we get our funding from One Care Vermont, Vermont's sole ACO or accountable care organization. That's where we get our funding from. They basically administer the all-payer model, which is the state of Vermont's healthcare transformation funding program. And One Care funds the SASH panels across the state. So they fund the staffing time, the SASH coordinator time, and the wellness nurse time on the ground, as well as travel, whatever else is kind of whatever else is about the operations of the SASH panel. And so we are starting to negotiate with One Care for next year, for fiscal year 2020. For One Care Vermont, they run on a calendar fiscal year, just to make things confusing. So they run January to the end of December, but they start their budget process in the summer because they have to send their proposed budget to the Green Mountain Care Board, which is the entity that regulates them, in September. So we are starting to have conversations now about the SASH part of their budget, and we will be asking for another 3.5% increase in panel funding. Last year was the first year that One Care took over our funding, and it's the first year we saw an increase in funding for SASH panels statewide since 2011. So we are not too shy to ask for another 3.5%. and we've already asked for that. They have made no promises, but it's under consideration. So you don't get what you don't ask for. So I can't guarantee we'll get it, but we're asking for it. We're also going to be, through this negotiation with OneCare, asking for continued funding for lead care coordination. And this is just this year we started getting payment for the work that some of you do within the Care Navigator system, which is all about the complex care coordination for high and very high risk participants and patients. So while the mechanism is going to change for 2020, OneCare has said they are absolutely open to continuing to fund us for that lead care coordination work. It's just going to look a little different than it has in 2019. So we'll be pushing for that as well and keep you updated. Right? Okay, so we thought, because we were talking about funding and administrative structure, that we'd also share with you this chart that does its best to explain how our statewide infrastructure and delivery system is set up in Vermont. And some of you have probably seen this before, but I bet some of you have not. And I think that it will help you understand, you know, just how it all works from a funding mechanism and from an administrative mechanism. So what you see on the top there are our two main funding sources. And they're not just funding sources, they're also the organizations that we are accountable to because they're our funders. So we have certain things we have to do for them because they're funding us. So OneCare Vermont is the main funder for, as I just said, for all of the panels across the state. And they use the all-payer model dollars to fund the payments for the SASH coordinator time and the wellness nurse time and whatever other incidental operational costs are there. It's a fixed payment amount, though, a little over $70,000 per panel to cover wellness nurse, SASH coordinator costs and incidentals. So that funding is from OneCare, and that funding goes directly to Cathedral Square as a statewide administrator, but then we're only a pass-through for that. So that funding passes through Cathedral Square as a statewide administrator to those 6 organizations that are right below there, which are the, who knows what those are? What do we call those? It's a really bad acronym. DRO, yes, DRO. Designated Regional Housing Organization. I'm very impressed. So we have 6 designated regional housing organizations. They're right there on that line there. And those 6 organizations have regional leadership responsibilities. They then get the funding from Cathedral Square as the statewide administrator, and then they send the panel payments from OneCare out to the different housing hosts that operate SASH in their regions. Now, the other funding that we get is from the state of Vermont, which is primarily the DAIL funding, but there's a couple other state departments that also fund us. And this is so the DAIL funding, I think I'm getting into the weeds, which I'll get to at the next.
Yeah.
Yeah. Am
I getting to go to the next one?
Well, hold on. I guess so. Hold on. Sorry, guys. I'm just trying to make sure I'm not getting too quickly into the weeds. Anyway, the point is, so the OneCare funding is primarily for the on-the-ground operations of the SASH panels. The other state of Vermont funding goes to Cathedral Square administrative entity and through us to you all for other areas that we focus on policy-wise, and also for all of the work that we do as a statewide entity to train you all, to provide quality assurance, to do data systems management, to do all the legal work, to provide for all the resources that we have in STAR, to do these kind of trainings. I mean, you name it, that is where that funding comes from.
And it also goes down to the bottom row here, which is the partners.
Yes.
And so the money from the Vermont Department of Sales does help fund partners to attend the staff meetings.
Yeah. So when you have a partner that comes to your SASH team meeting, they're getting paid $50 an hour for their time, and that's funded through the state of Vermont, Dale. That funding also funds those of you that are SASH grantees. You know who you are. We pass through that money to you as well through the Dale funding. Okay. Yeah.
So SASH grants.
Yes.
Molly, you'll get into it, but this is just a visual of some of the main ones that you hear about a lot.
Yeah.
Okay. Perfect. Thank you, guys.
Okay. So just to clarify, when Melissa put out the content for today's meeting, she asked for questions, and one of the questions from the field was they want to understand better some of our grant sources. All right, so let's get going. Okay, so some of the SASH grants. So, and this is all the funding we get from the state of Vermont side, okay? So this is separate from the OneCare payments that your housing hosts are getting to fund your time on site, okay? This is the state of Vermont section of the funding. And it made up of a number of different grants. So one, and you'll hear us say this, is the MCO grant, and this is the funding we get from Dale. So I know somebody's thinking, what does MCO stand for? And I'm going to tell you what it stands for, but it's going to be really unsatisfactory to you because it doesn't actually clarify anything. But MCO stands for Managed Care Organization. And the reason this grant is called the MCO grant is because the state of Vermont is considered a managed care organization by the federal government, and some of the funding that the state of Vermont through Dale passes out to a bunch of different organizations is available only because the state of Vermont is a managed care organization and recognized as such by the federal government. Is that exciting to learn? Okay. Some of you are actually shaking your head, but you're probably just being polite. But anyway, so but I know I use that language sometimes, so I just want to be clear. So this is our grant, our big grant from Dale for our statewide administrative work. We already told you what this is covering. It's and it covers not all of our admin team staff time up here, but some of it. It's not enough to cover all of our time for our SASH administrative team. These other grants help augment that funding to make sure all of our staff here on the admin team is funded adequately. The next dollars we get through the state of Vermont is called the 1815 grant. This is the grant that Casey Dorner, our health systems educator and wellness nurse extraordinaire, oversees. And this is actually also some federal dollars that flow through the state of Vermont by way of the Vermont Department of Health. And this grant, we actually currently have a 5-year grant, which is fantastic to have that many years. This grant focuses on chronic disease prevention and management. And for these 5 years, the key diseases that the focus is on hypertension, diabetes, and cholesterol control. Right up our alley. The another main source of state funding for SASH is our Health Information Technology Grant. We call it the HIT grant. This, again, is some federal dollars that flow through the state of Vermont. This time it's the State of Vermont Department of Vermont Health Access, also known as DVA. And this funds all things related to data tracking, management, outcomes, all the PHL stuff. So if you think about what Madeline and Jen do for you all, they wouldn't be able to do any of that without the funding from the HIT grant. So all of these grants, in one way or another, support you all on the ground, but it's all through supporting the administrative infrastructure. A couple other grants that we get through the state of Vermont, these are more recent and small, very small. One is the opioids grant that we got just this year from Dale, the Department of Disabilities, Aging, and Independent Living, and this was to raise awareness of opioid use and overdose for older adults. And then we also have a partnership with the Community of Vermont Elders, also known as COVE, to partner on educational efforts around the work they do, the state Medicare program, the Medicare fraud. So as you guys know, we've already done some educational outreach about both of these focus areas for these two grants. So, so all of those dollars that come from those grants that I just listed primarily help fund the administrative staffing for my team to do the research and the training and the work on PHL and the grants management and the quality assurance site visits. It helps to pay for what we get up on STAR and how we continue to manage that. All SASH staff day. Melissa's reminding me of things. So, that's how we need all of those sources in order to fund, basically the budget for the staff administrative team. So even like travel time for Michelle to come and do site visits, all of these grants together. I will say that these grants also come with, nobody just gives you money and says, we trust you to do a great job. They trust us because they wouldn't keep giving us this money, but it also comes with very specific results-based accountability that we have to do. So we have to report out on our outcomes, and it's usually set up in a set of deliverables. So we have to deliver a couple times a year information to our funders, all these that I'm just listing here, about what we've accomplished with their funding. And so that's when we're asking for you all to, get information into PHL or into JOT forms. It's all because we have to make sure that we're reporting out accurately on the work that you're doing. We would never accept a grant that we didn't believe directly meshed with the work that you're already doing, or we know that we need to be doing because, would I think we'd be needing to be educating our participants about opioid overdose 10 years ago? No. That would not have come to my mind 10 years ago when we started SASH, but as we all know, we have an opioid crisis right now all over the nation, and, gosh darn it, it's not just young people, it's older people too. So, there's new areas that we're going to have to flex into based on how life changes and how needs change of our participants, and so things like the opioid work and the fraud, things like that are things that we may not have thought of originally, but from our perspective makes sense, and we would not be accepting grants that were things that were far off in left field. The work around the chronic disease prevention and management through the 1815 grant, when we talk about the core elements of the SASH model, one of the key ones is self-management, and that's around self-management of chronic disease. So, that has always been a slam dunk for us because that's work that you all have been doing all along, working individually with participants on health coaching and helping them manage their disease, and also making sure in your community healthy living plans that you have programming around those different chronic diseases that challenge our participants. So for us to actually get funding to help provide you guys tools and resources and training around those areas is so valuable and something that we're very, very thankful for. All right, so I'm going to be quiet for a second, and I'm going to ask you if anybody has any questions about some of those grants. Let's just go down, or the chart that I shared with you. And you can chat things in. Why don't you bring that chart up again? That one, yeah.
So you may be muted. You may have to either raise your hand or chat in your questions so that we can either unmute you.
So hopefully, whoever asked the question, I answered it, or I just bored you guys so much that you have nothing else to say.
I think we have a hand raised.
Oh, maybe we have a question.
Paul Hawkins has a question.
Yay.
So can we unmute Paul? All right, Paul, it says you're unmuted, but that you're muted on your end. so we've got you unmuted over on our end, but it says, there you go. Hi, Paul.
Hey, good morning. You mentioned something about when our partner agencies come to our monthly SASH team meetings, they're getting that like $50 fund or whatever it was you said. Is that
$50
reported?
an hour.
So do they report that to their supervisor and stuff, or are they just automatically getting that on the assumption that they're here?
That's a great question.
That's a great question.
No, so one of the functions of the DROs, the Designated Regional Housing Organizations, is to get invoices from the partner agencies that lays out, that shows the meetings that people went to, the dates, the time, and then the team members from those partner agencies, their supervisors are signing off on those. And then we do a kind of spot quality assurance check from time to time here on the admin team to sometimes we'll email us, like you might get an email at some point, Paul, saying, okay, so we have in the latest invoice from AgeWell that so-and-so came to your meeting on March 15th. Do you have, is that what you have? And, so we do that periodically. It's like a spot check. But there's definitely a paper trail. So that's one of the responsibilities of the Designated Regional Housing Organizations, is to gather those invoices and then pay those out, and that's paid by way of that MCO grant that I talked about.
And the spot check usually comes from me in form of email.
Yeah.
I'll email and say, hey, Nancy, did so-and-so show up at your team meetings on these days? And then, she'll email back confirming or not. And so that happens, I'd say, probably about quarterly.
Yeah.
But that's a great question. Just no, we are not just assuming that people are showing up.
Yeah.
Any other questions? It looks like somebody else has a hand up too, or was that still Paul? Oh, still Paul. Okay. Any other questions? Oh, we had one come in from Diana Rule, which actually, Diana, we're going to get to. I answered it in the chat, but we're going to get to on the next slide too, which is about the opioid training.
Oh, good.
So if we don't have any other questions about funding, we can go ahead and move on. Is it in the chat?
Yeah.
Hold on, Kirsten's telling me we have another question about the funding, but I did not see that one. Oh, it just came in. Okay. With the One Care, I was told it's for Medicaid and or Blue Cross participants. I'm taking care it will eventually be all insurances. Oh, that's really interesting, Kim. I actually got this question. Casey sent your question to me. Kim was just recently trained in Care Navigator.
Mm-hmm.
And at the Care Navigator training was informed that that was just for Medicaid and Blue Cross Blue Shield. But that's actually not accurate, as I've been told. So I was going to reach out and see who you received the training from so I could pick their brain. I didn't know if there was something different going on currently in the Northeast Kingdom with their adoption of Care Navigator or not. So I couldn't answer that question right out of the gate without doing a little digging. But I was aware of the question, and I will find out for you. It doesn't ring true to what I know to be happening around the rest of the state, but I will check for you.
And I would just say that, generally speaking, and this sounds like a much more specific thing that Melissa will follow up on, but One Care Vermont is funded with all-payer model funding. And what that all-payer is referring to is all payers in the state. And when we say payers, I don't know why they say payers, it's insurance providers. So all insurance providers are paying into One Care for this health transformation, new way of paying for health care. So that includes Medicare, Medicaid, Blue Cross, Cigna. We don't have that many insurers or payers in the state of Vermont, but all of the payers have agreed to pay into this kitty that goes to One Care, and then One Care gets to send it out in value-based payments to programs like SASH and to primary care to do more prevention, to do care coordination through Care Navigator. So that's why it's called all-payer. It's just all the insurance providers in the state of Vermont are contributing funds for this new way of paying for health care delivery in the state of Vermont.
Great. I saw that, yeah. So I will check on that, and I'll get back to you, Kim, as soon as I track down an answer for you. So the next thing was just to talk a little bit deeper about the opioid education for participants. And I think really we learned at a meeting that we were just at this morning that maybe the wording that we're using around this is a little off-putting. So really all we want you to do, so anyone that came to the May SASH coordinator training learned about opioid use in older adults. And our request from you is to then go forth and provide that same information to your participants. Amy created a training that you can literally just kind of plug in and play, and there's pauses for conversations, but it's about 20 minutes, and it's as canned as it could be, so we aren't asking you to do much other than just share that with them and then talk to them about it. We don't feel like to do this you need to be some sort of subject matter expert. Really, it's completely fine to just say, hey, here's some information that I just recently learned. I wanted to share it with you, and then maybe we can talk about it. When you do that, if you have any questions that come up that you don't know, that is absolutely okay. Please send them to the admin team, and if we don't know them, we will find the answers for you, and then you can get back to people. But I think it's really important to share this information with people and not shy away from it because you may not know everything there is to know about opioids. We don't either. We only were able to create this because we had someone that was able to do a giant lit review of all the stuff that's out there about opioids in older adults and pulled it together for us, and then Amy turned it into one of her amazing trainings. So we're hoping through one of the grants that Molly just mentioned, the request from Dale is that we will share this with as many of our participants as we can by the end of August. Once you have done the training, we would ask that you complete the JOT form, and I can click on this in just a second to show you where. And I will say that so far I know of one person that's provided this in the state. There may be others that just haven't filled out the JOT form yet, but I did check in with her, and she said it went really well. It was really easy to present, and the people seemed very engaged in hearing about it. So I also presented this at an adult day program up in St. Albans to the staff there, and I have to say they found it to be very useful as well. So I'm going to see if this works. I had a link embedded in here so I could show you. Oh my goodness, it's working. Yeah. I'm so excited. Everything is just working today on this. I'm really stretching myself here without Amy here to help. So when you go to the SASH intranet and you go to shared resources, you click on substance abuse, and it brings you to this page. And so in this page, I'm scrolling because I'm trying to look around a thing that's on my screen. You have Understanding Opioid Use in Older Adults Training under Program Resources. If you just click on that, you can find the recording by clicking the here, and you can also find the JOT form that we're asking you to fill out. And I would just ask that if anybody has any questions about this request, please let me know. I'm happy to talk you through it. Or, if you genuinely have some concern about why you can't offer this at your site, let me know that too. And we can either work through it or we can have somebody come offer it with you. I mean, that is something that we did with the suicide prevention work because there were just some people that this was maybe too sensitive of a subject or it hit a little too close to home, and we completely get that and are just here to help you make this happen in any way that we can. So it looks like we have questions coming in. Yes, Kim, if you can do it, either like lump them together and do one or do one after each. I really don't care. We just want to capture the number of people that this was offered to. Oh, sorry. Is there a way to show the training without internet in the building? So yes, and that's a great question. We understood that that was going to be a problem for some people. You can print the PowerPoint packet and either just talk it through with people or share the PowerPoint in a paper form. I get that it's still printing. It's not ideal, but we did offer that as well. And I think that can also be found in that same section of STAR. Okay. So any other questions, or I'll move us along to the next conversation?
And this is Molly. I would just say, as I've thought about how you guys might be able to incorporate this, since it's not very long, and again, it's really what we're asking you to do is just kind of share the information that you learned, not expecting you to be experts. I'm just wondering, what we hope is that these kind of things are things you can just fold into your community healthy living plan as you're kind of thinking that through, or even potentially having it add on to a coffee hour you have, that you already have people at anyway. So just thinking about ways that you can easily kind of add it in without it having to be this major, because it's not really presentation per se. It's really a sharing of information and opportunity for discussion. And so anyway, that's just some thoughts on that.
Absolutely. And I think the idea is that we're hoping that by doing this, we're hoping that we're actually giving you stuff that you can then go, oh, that's, when I do my CHILP, it's really easy. I have to do this opioid training. I want to do this. I'm going to do that. So it's just one of the things that you're doing. It doesn't have to be in addition to the stuff that you're already doing. It can be one of the presentations that month. And then also, we just wanted to share, too, these educational brochures. So we ran some numbers recently, and we realized that everybody's doing a really great job doing the one-question screen about using alcohol, which is this number 12 question right here. Do you sometimes drink beer, wine, or other alcoholic beverages? And if yes, continue to the next question. But then, unfortunately, with the way PHL is, we couldn't put this if you drink alcohol was education provided question number 13, which would have been ideal, because we added it after the fact. So we had to add it at number 17, which means you have to skip down some to answer it, or you have to answer it when you get there. And I get that that's not the easiest workflow, but what we're hoping by was education provided means anytime someone says yes, they consume alcohol, we're hoping that you can either give them this brochure, and I'll show you where you can find that. Also, we have dozens, hundreds of these at the office that we can get to you. But we're hoping that you'll provide this to anyone that consumes alcohol, regardless of whether it's at a concerning level or not, mainly because as our bodies change as we get older, the way that we process alcohol changes, and we just want to use this as an opportunity to educate our participants. So you can reach out to us, and we can get you those brochures absolutely free. Luckily, they're given to us absolutely free by BDH. Or if it's like, I ran out and I'm not going to get any more for a little bit, you can click here and it will bring you to, again, I believe the substance use page on STAR, if it's going to let me. I might have jinxed myself getting overly excited last time when I said everything was working. But on the substance use page on the left, oh, you know what? Why don't I do this, because it's the same page. I'm going to go back and click here. I feel like I outsmarted the presentation. Oh, it's here. Okay. But then it's not showing up on there. Why didn't it work last time? Okay. Anyway, under the substance abuse resources on the left-hand side, it's not the most intuitive. It's called alcohol, aging and alcohol, what you should know, and that's a tab under professional education. So you can click in there and get the brochure in a printable format. Sorry, it's not working today. And I also don't know how to get back to my presentation here.
And this is Molly. I would just add, just so I can kind of connect this back to what I was talking about earlier around grants and requirements for outcomes and deliverables. So this work around passing out the education brochure around alcohol use ends up being one of the outcomes that we have to report to the state of Vermont, to Dale on a regular basis, or twice a year. And so for last year, when we reported on this grant last month, May 15th, we had to tell them how many brochures you guys had passed out. That was one of the deliverables. As they said, alcohol misuse, substance misuse is a priority. We're looking for you all to ask your participants about their use, and then if you get a question, if you get a certain answer, then we need you to pass out these education brochures. So we had a deliverable that we would get at least 300 of those brochures passed out. When we ran the numbers through PHL, we didn't meet our target. We were actually at 200, and we realized that, and believe me, I can rationalize anything, and so I did to our grantee, and I said, and it was true. I mean, we didn't get the brochure up, into a place that was easy for you guys to find, quickly, and also, as Melissa was just showing, where you actually mark to say that you gave the brochure, because of PHL, we couldn't put it right under the question about substance misuse. So I was able to explain why we hadn't met our target, but that we fully expect to meet our target the next year. So that's just an example of where, there's the work that you guys do is incorporated in these grant write-ups and this scope of work with attached deliverables, and we have to, a couple times a year, report on kind of the performance of our program to meet these goals. So that's just an example. So we definitely want you passing out those education brochures, and I have no doubt that now that that question is in there and has been in there now for a longer period of time, that we're going to meet that deliverable without a problem next year.
Great. And then also, in that same vein, the UCLA loneliness screening. So I think what happened here is that it used to all be in one tab in PHL, just under sort of was it under the Lubin, Madeline, or was it just labeled like social isolation? Yeah, so it used to be that social isolation was one tab, and once you clicked in there, you would get the Lubin social network screening, and then you would get the UCLA loneliness screening all in one tab. Well, the problem with that was that it was calculating them sort of all together, and then we weren't able to show this many people are feeling socially isolated, this many people are feeling lonely. We weren't able to show those separate results. So we did go through at some point in the past year and pulled those two out, and now there's a Lubin scale and a UCLA scale. Well, since we did that, we have found that the UCLA is not being completed as often as the Lubin. And so it occurred to me when I was making this slide that that's probably why, is that it used to just be like boom, 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 all done in one, and now it's these two separate things. But we would like you to please make sure that you're completing the UCLA loneliness screening with people when you do their annual assessments, because that's something that we're going to focus on, hopefully trying to figure out how to move the needle on going forward. So it's just the same 3 questions it's always been, but you can find it in its own separate little tab right below the Lubin. Any questions about that? Okay. It feels a bit overwhelming to ask 6 Lubin and then 3 UCLA. Okay, so we have Paul Hawkins is saying, actually, Paul, I think that's a really good point, and I would love to explain why we have you do that. So Paul said it feels a bit overwhelming to ask the 6 Lubin and then ask the 3 UCLA. And I think that this is a great opportunity for me to explain this, because this was my soapbox for a really long time. We just had the Lubin, and the Lubin is a social network connectivity question. So it asks 3 questions twice. One's about friends and one's about friends and one's about family. But it says, do you feel connected to people in such a way that you have someone to call if you need assistance? Do you get to visit with people X number of times? The problem that I have with the Lubin is that you could join SASH, score really, really low on social connectivity, come to every single one of our programs, get really involved in the program, and still score really low on social connectivity, because just because you're now engaged and active within your community doesn't necessarily mean that you now have more friends or you have more family that you feel connected to. So to me, social connectivity is different than loneliness and possibly isolation. So I beat the drum for a really long time to get the UCLA loneliness screen added, because I think that's where we can document the work that we're doing and the change, the impact that we're having. We're not going to be able to necessarily get people more connected to their family or in a more meaningful way. We can certainly try, but we can get people more connected to the community, to the programs. And I think that that's going to show up a lot more in the UCLA loneliness than it shows up in the Lubin. However, I think the Lubin is important to understand what kind of support system someone has. So I get that it's 9 questions instead of 6, but I would definitely make the argument that they're both important. And then Dee Dee Tracy had the question, what are our responsibilities when people are really lacking in the social area? I do my best to connect them and get extra helpers. Just curious if there's steps required of us. There are not. I think exactly what you're doing is what we would ask of you, is to identify when people don't necessarily have those connections and try to help them figure out who they could be connected to differently. Okay, so Paul said he agrees with what I just said. However, in the moment of the assessment, it feels overwhelming to them. It's good to hear. I'm not sure what to do about that. It's something that I want to think about and maybe pick your brain about a little more. And I'd be curious how many people are saying that or feeling that. You know, is it one or two people or is it everybody? And so I would just love to maybe get some more information from you on that so we can think about it. Okay, so this is all great, Steve. I love this. So Paul's just saying he's doing his job and making more work, I think, for me. And it's so biggie, but he's learning how to do it. That I appreciate that, but I do also want to just hear how it's going because I'm not in the field asking these questions. So if you have feedback on how it's going, I really, really want to hear it. And it could be something where it's like, oh, okay, well, then we need to pick one.
Yeah.
You know, we're definitely open to having those conversations. So Dee Dee Tracy said that she's found that people are incredibly honest, which I really appreciate. And Solange seconds Paul. It feels the same. It's a lot for the participants. Kimberly Bishop says that she thinks people appreciate these questions because it helps them feel like someone cares. I just love the conversation. Sorry. I mean, whatever we ultimately decide to do, I just love that you guys are sharing this because in my mind, this is a no-brainer, but then, maybe it isn't a no-brainer. So definitely shoot me an email if you have some examples of times when it's just been really overwhelming or if you have ideas or anything else. Diana Rule said, with initial assessments, sometimes we do not already have that trust, so sometimes we aren't there yet. Later is easier. Oh, that's a great point, too. There's nothing saying it has to be done right at the initial assessment. Perfect. That's a good idea. Okay, well, I'm glad I brought that up. All right, moving us along here, because I think we have another poll. Oh, we do. And, reassessment's always easier than initial. Okay. Well, we definitely want to set a baseline, though, so maybe, throwing those 3 in at another time. Definitely something to think about. All right, let me see if I can get our next poll, because this is going to be another topic discussion, I can tell. All right. How would you describe your usage of the SASH beat? So we've given you the options of it's my monthly go-to, can't wait to open it when it comes. When I find the time, I give it a glance. A couple times a year, I check it out, or rarely, or never. That's supposed to be never. That's a typo. Rarely or ever. People are voting. Oh, I'm really, really happy with the initial results, I have to say. What was going on in the room? Susan, what do you got? Okay. All right, so I'm going to end the poll in 5, 4, 3, 2, 1. Okay, close. And share. I'm getting good at this, you guys. This is so exciting to me, I have to say. I love that people are finding this useful. But hold on, before we dig too deep, I've got another poll. So, all right, so we've got 33 and 66. And then the next poll, which relates, is what's your favorite section of the beat? And unfortunately, I'm limited to 5 answers. I couldn't list all of them. So we've got the news and update sort of at the top. That's usually where, like, Molly will give an update on what's going on with the program. The team resources, that's where we give you some ideas of things that you might be able to share with your participants. The QA topic is usually something Michelle writes about how to improve one of the processes that you're going through. The Flash Grab and Go, where we give you just canned articles to share in your SASH Flash, or the PHL Q&A. Fair.
Which one? So those are all standing sections of the beat, if you didn't know that.
Right, they're in every one.
And there's we're trying to educate you as well right now.
There's a couple other sections
feedback,
too, but I couldn't fit them all. So like there's also the training opportunities.
Number 1?
Okay, number 1. All right, so I'm going to close this poll in 5, 4, 3, 2, 1. Okay, and then I'm going to share the results, which is, okay, news and update and team resources, and the Flash Grab and Go.
I'm surprised the Flash Grab and Go isn't it?
Higher. Yeah.
But you can only pick one.
Mm-hmm. Okay. You know what would be really helpful? Okay, sorry, we've got someone in the room here, Nancy Reynolds, who's saying that it depends on the length of the article, that if it's too long, she can't use it. And I think we do try to keep that in mind when we put stuff in there, but we could be overestimating the space that you have. So if you could give us an idea, like, yeah, so if you're like, you know what, keep it to 200 words or less or whatever, that kind of feedback would be super helpful. So I would love to just hear any kind of thoughts or questions or ideas that you have for improving the beat, or it sounds like people are using it, which makes me incredibly happy. And one of the things that we've struggled with is how best to communicate ideas with you all. And so when I first started years ago now, people said, we get too many emails from the SASH admin team. That was like the number one thing that I heard, was that we were emailing too often. So we said, okay, well, we're going to really par down on our emails and we're going to put everything into the beat. But then it seems like people had no idea. So we'd say, oh, did you hear about such and such? And they'd say, no, I have no idea. So then we were concerned that maybe people weren't reading the beat. So we went back to starting emailing more. And so we really just want to figure out how to make this the most useful communication tool it can be. And also now that we have STAR, maybe some stuff can go up on there. If people are checking STAR more frequently, maybe that's the way we can be doing it. But I would love to take a second to just hear your feedback. Solange says she needs to make time to use it. Use it more. It's helpful.
Go back to
I'm going to close the poll. Sorry.
Go back to the one that shows the results about how often they do it.
I don't know if I can once you do it.
Oh, okay. Right.
But the one I can see, if I can see it. Let's see. Oh, look, I can.
Oh, good. Okay.
Cool.
All right.
So
I guess this is Molly, one of my questions is, because I would love to see the 66 and the 33% switched.
Mm-hmm.
Like, I would love to see that 66% of you, really look at it on a monthly basis. Because I do feel like it's, we put a lot of thought into kind of what is kind of key information to share in that given month. And we don't want to send so many emails because I know how overwhelming that can be. So, any ideas around, is it something that we as an administrative team can think about delivering the beat differently so that we can get more of you thinking of it as something you definitely want to get to during that month, or is it really just a kind of time management thing?
So Dee Dee said time is always a factor.
Okay.
I think the way this question is worded too, that it's my monthly go-to and I can't wait for it to come. Like that's
too energetic.
That way, because I don't feel like, oh my gosh, so I always read it.
Okay.
It's not like, oh, it's not my monthly go-to.
Okay, so do you think it's something that you get to on, like, at some point during the month?
Okay, I read it within a day of getting it. It's just that it's not my monthly go-to, and I can't wait to get.
So,
we're trying to be too exciting with
I don't know if you guys can hear what's happening in the room, but basically I was overzealous is what it boils down to. So what people in the room are saying is like, yeah, they read it every month, but it's not considered like their monthly go-to or can't wait to open it. So maybe I just needed to tone this down a notch and we would have gotten that number flipped.
Get real answer. It's more accurate about how I feel.
Yeah.
Okay.
But you would get to it at some point
I
during
always
that month.
read it. I always look at it. It's just that.
Yeah, I'm glad I brought this up, because
I
now
know,
it's
like,
a very
oh my
different
God.
type of it.
Yeah. Well, so we've got quite a few chats too, so I just want to
Okay,
read through them.
sorry.
Paul Hawkins said, I do look every month, but some months it's a glance through, other months I pull things to use, click on links and use it fully. Other months just glance. It depends.
Right.
Diana Rule said, I think that some of us are in between the two. We look at it each month, but we don't always have the time to read it all. We glance and then go back when we have to. Again, me being overzealous, thank you, okay. Paul, what Diana said. Jesse Cudworth, what Diana said. Ann Eddie loves getting it, which is great. So mainly it's definitely this is helpful because
So great.
we are glad to hear that it is a useful tool, but also please know we are open to suggestions. So if there's something that we're missing that you wish was in there, if the articles need to be shorter, if the, anything. Just shoot us an email, let us know any of your suggestions. We are happy to hear them and amend as we go.
Yeah, and please send photos from your panels, because we like to see photos from all over the state that we can then put in the SASH feed. So, please just take a moment to send us photos. I know a lot of you take photos of different events, especially like in the summer, you're going to be doing a lot of stuff. So it's just great to have some freshened up photos to share.
And I mean, you don't all need to be Lisa Gabush, who sends us like a photo a day and does an amazing job with that. And they're beautiful. No, you need to keep doing that. But so yes, we don't need quite that much, but they're wonderful though. Anything you can send is great, and we really, really appreciate it. I know Michelle Whitney just sent us a picture of maybe it was 2 weeks ago now, but they had cooking students come and preparing for the whole semester, preparing group meals, and it was the last one. So they had all these students that were graduating with their chef's hats on, and all the participants, and I just loved every single thing about that. So.
And the photo contest is still going on, so you can also win $25 if you get chosen. So.
Perfect. And then our last poll question, and this one is really, really important. What's your favorite flavor of ice cream? Chocolate, vanilla. I had to put maple because it's Vermont. Bubblegum because I'm obviously goofy. Or pass, none for me.
Maple.
We got to vote for maple in the room.
I have a funny thing to say about maple after
Molly's got a funny story about maple. Okay, I'm going to close this most important poll here in 5, 4, 3, 2, 1. Okay. And then I'm going to share the results. Yay, chocolate's the winner. Okay. And then maple. Okay.
So the funny story I have to say about maple ice cream is my youngest daughter just started her summer job yesterday, and she's a tour guide at Ben & Jerry's in Waterbury. So she was shadowing the person, whoever the tour guide was, and she gets this whole booklet of like interesting things you should know about, ice cream and what questions you might get. And it ends up, as I was looking through this and she was telling me, it ends up that maple flavored ice cream is like no other state, like when they poll people, nobody likes maple ice cream except like Vermonters. And what it said is that for most other people, when you say the word maple, they think of furniture. And not, like wood, like maple flooring, so like they don't associate maple with ice cream at all. So like when they polled about like, should we do more with maple, people are like, no, like don't do that. But Vermonters, yes. So,
well, and really this is the way to get people to use the chat, is talk about ice cream, right? So we have When Coffee Buzz isn't available from D.D. Tracy, or peanut butter with dark chocolate chunks, New York Super Fudge chunk. My favorite is black raspberry. Oh, that's a good one too. None of these for me. I like cherry vanilla. You can send it to 103. And I put cherry Garcia. So.
I love Chubby Hubby.
Oh, that's the one, bananas? Is that?
Pretzels.
Oh, that's Chunky Monkey I'm thinking of.
Yeah.
Nice.
No, maybe I'm thinking of. No, you're right. The Chubby Hubby is the pretzel.
Okay. All right. That's lactose intolerant. Okay.
Sorbet for you.
I think we'll end with the lactose intolerant note. Perfect. Any last words that aren't about ice cream? Okay. Thank you all so much. Really, really helpful and giving me some stuff to think about. I appreciate it.
Yeah.
Have a great day.
Bye, all. Bye.